Okay, so what I'm going to be doing in this video is to take a look at the first session for Tony Soprano in The Sopranos. What I'm going to be doing is kind of looking up on some of the key points and things that happen in the session, some of the things that the therapist says and how she deals with Tony Soprano, and just try and pick apart a little bit of some of the dynamics and issues or things that I'm picking up on around the therapy.
Have a seat.
Okay, so there's a few bits there you can pick up on his body language as he comes into the room. Firstly, you can see that he's taken a real look around that office. He's so almost like in surveillance mode. He's looking around his environment here. This is somebody that I think is very unsure about being there. He looks very anxious, and his hands go into his pockets as well. You know that this is somebody that's really not comfortable being in this situation. He sort of, he stood there, he's looking around, and he's just taking in the environment, but in a very sort of suspicious way. If we just kind of play that bit back, you can see as he walks in, just how he's looking around the room.
Have a seat.
Okay, so again, his body language is saying so much about what he is experiencing right now. As soon as he sits down, his leg goes up onto his knee. Now, that's a kind of a classic sign of a barrier between him and the therapist. There's nowhere for him to hide right now in that room with the therapist. So a knee up, a leg up onto a knee is kind of like a barrier. It's putting something in between you and the therapist. And his face looks so suspicious right now. This is somebody who's probably anxious. Is going to be quite resistant, I think, to the idea of being there. Who doesn't feel safe. You know, this is like almost if you're out in the jungle or something. You're looking around. You're checking your surroundings. You're making sure that it's okay. It's safe. You want to put some sort of barrier away from, like, the predator that he's probably perceiving is going to be the therapist right now. Okay, and again, he's almost looking out the door there, I think, or a clock or something. He's again, he's not wanting to be there right now.
My understanding.
Now that's kind of an interesting sort of bit there with the beginning of the session. Now, for some sort of models of therapy, they wait for the person to speak before they're saying anything in the session, because it gives a chance for the person to sort of voice something. But you could tell in that moment there that I think that sort of Tony Soprano would have probably been happy to have sat there for the whole 50 minutes or hour of the session and not sort of voiced anything. He was definitely not going to be forthcoming with voicing anything right there, and instead the Dr. Melfi, the therapist, sort of steps in to say something to begin the session.
Family physician is that you collapsed, possibly a panic attack. You were unable to breathe.
They said it was a panic attack because all the blood work and the neurological work came back negative. And they sent me here.
Okay, so Dr. Melfi at this point, then, what she's done is she's pointing out the potential problem here, but she's voicing it in a way that some other professionals have voiced this about him, that around kind of the panic attacks. And Tony's response right now is to say, well, that's what they've said. They've said that this is my problem, and there's going to be a potential problem here if that's not really dealt with, because he's not really locating the problem in himself. this is something called externalization, where he's sort of saying, well, that's what they think about me. So out there, they think I have a problem. Well, we've got no understanding right now if he also sees this as a problem as well. And the potential risk you run as a therapist, that if you sort of try and push forwards right now to do some work with him on a problem that other people have said are a problem, you're going to run into him potentially disagreeing with that and not wanting to work on it. So I think a really important bit right now is going to be able to see, well, what's kind of his thoughts or feelings on this? Is he in agreement with this? Does he think sort of something else is potentially the problem? Without that bit, you can't really move forwards, because if you try, you're just going to be hit with some resistance here, and potentially the therapeutic relationship is not really going to be able to push forward at all.
And they sent me here.
You don't agree that you had a panic attack?
Okay, so that's great by Dr. Melfi there. So she strayed away, she puts it back onto him. You don't agree. She wants to get it exactly from him, which is kind of what I was saying there, that's a really important question. And what you'll notice is when that question is pushed back to him, you see some signs of anxiety. So what I'll do is I'll sort of show that little bit again, and what you'll notice is there's a sigh, which is your diaphragm sort of compressing, and his foot begins to flicker as well. Now this is actually a sign of a rise in anxiety, and you might be asking, well, why would his anxiety start to go up when she says you don't agree with that? Because the thing is that he may be getting anxious because he actually on some level does know that this is a problem for him. By almost saying that, well, they think this is a problem for me, he almost sort of locates it elsewhere. So really he's like, well, they think this is a problem, it's fine, I'm okay really. When she says about kind of agreeing with that or not, he's almost then having to say to himself, well, on some level, do I agree with this? And his anxiety might go up, because that might be a realization. Oh yeah, I actually do believe that I have a problem. And that might be an uncomfortable place for him to be, which is probably why the anxiety went up. So if I just show that bit back there, you can see, again, this sigh, the shake of the leg, which is a sign of anxiety, which to me would suggest that this question was really important to ask, because obviously something is happening for him right now by being asked that.
You had a panic attack. How are you feeling now?
Good. Fine.
Okay, so I really like this response from Dr. Melfi here, because she's kind of not letting up on him really. So you could see his anxiety went up, there's pressure on him at being asked these questions, and then she follows that up with, how are you feeling right now? So it's even more pressure on him right now to sort of try and for him to voice what's going on. And his response to that is to kind of dismiss it really. I'm fine, I'm okay, nothing's really a problem. Well, actually, what we could see there, that his anxiety was going up, that he was uncomfortable, no part so far in this session would you describe him as being fine. So that's kind of quite a dismissive response, I think, to sort of say, I'm fine, I'm okay. So it'll be interesting to see kind of what they're sort of followed up with sort of after that.
Fine. Back at work.
What line of work are you?
Okay, so it's a really interesting sort of follow-up as well to that point too. So he says there, I'm fine, I'm okay, I'm back at work. And that's followed up again by that kind of little rise in anxiety in his foot. The little kick out that he does, which again, that's a sign of anxiety. And then that was followed up actually by him kind of slapping his foot as well. And that's almost, that kind of reminds me of sort of, just kind of get on with it. I'm fine, I'm good, I'm okay. Let's just crack on with it. I'm doing okay. That kind of sort of keep calm, carry on sort of mentality. So it's almost as if he's sort of saying to himself, I'm fine, I'm good, let's slap. I'm okay. Let's just keep going. Everything is fine.
What line of work are you in?
Waste management consultant. Look, it's impossible for me to talk to a psychiatrist.
Any thoughts at all on why you blacked out?
So that's kind of an interesting bit there too, because I think that's a movement forwards from Tony at this point in time. Because to begin with, it's almost like his body language and the way he's coming across is showing signs that actually I shouldn't really be here, I think, or I don't want to be here, or I'm uncomfortable with being here. But actually when he sort of says there about not really being able to speak to a psychiatrist, I think that's a really important communication. And it'd probably be interesting to maybe sort of pick up on him about why he isn't really allowed to speak to a psychiatrist. And because there may be some reasons that some barriers that are going to get in the way here within the session that would probably need to be sort of picked up on, really. So I think that's actually quite I think that's almost like a little bit of a breakthrough there for him to voice that, to say that I actually can't really speak to you, which is different than I don't want to speak to you. I think that maybe suggests that there's a barrier that would stop him from speaking, which is, if he was to say I don't want to speak to you, that's different. That's basically saying I don't really feel that I need to be here. But actually to say I can't, there may be some part of him there that actually does want to be there, but there's something that's kind of getting in the way of him being allowed to speak to her.
Any thoughts at all on why you blacked out?
I don't know. Stress, maybe.
About what?
Okay, so Dr. Melfi is somebody that you feel she's not going to let up on her inquiry with Tony. So he sort of throws out some sort of kind of quite vague general response. Maybe it's stress. But, there's not really much detail on that. He's not really curious about himself either. That, in a sense, he doesn't really want to understand his issues. He doesn't really maybe want to sort of fix them. And she sort of pushes for more. She's sort of saying, on some level, the sort of the communication here is, give me a bit more here, because what does stress mean? It's so vague. It means nothing. It doesn't really tell us any information. So she's doing the right thing. She's pushing for more. She's trying to get more out of him to understand this problem and his sense of the problem too, which I think is going to be really important if they're going to do any work together.
The morning of the day I got sick, I've been thinking. It's good to be in something from the ground floor. I came too late for that. I know. But lately I'm getting the feeling that I came in at the end. The best is over.
Many Americans, I think, feel that way.
Okay, so that's interesting, that point there. That is, you almost get a sense that there's signs here of him beginning to open up a bit more. And I think that's potentially the result of her questioning towards him. That she's actually, she's inquired. She's kind of curious about him. She wants to know bits about him. And I think that can be really helpful for a person in therapy, is that, this person's actually kind of interested in me. They want to know more about me. So maybe I'm going to start to say a bit more about myself because they're paying an interest. And I think that's where this has maybe led on to Tony to begin to sort of open up. And he's talking about something in particular here, that something's over, that so there's potential loss, that something he was wanting for himself or something he's had has now gone. And we're moving into a bit more detail now. We're getting a bit more of an understanding of potentially what this issue is for him. and he's starting to open up. It's kind of still a bit unclear. I mean, just listening to what he was just saying there, it's kind of felt a little bit abstract. I'm not fully understanding of potentially what this problem is, but he's beginning to declare an issue that he's sort of dealing with.
I think about my father. He never reached heights like me. But in a lot of ways, he had it better. He had his people. They had their standards. They had pride. Today, what do we got?
Okay, so it's another really helpful piece of the puzzle that he's giving us here. So there's something here about the relationship between him and his father. So what he's describing here is kind of he's achieved more than his father, but there's something about the particular way of living that his father had that he kind of aspires to by the sounds of it. There's something that's important to him, particular ways, standards that they live by. And what he sees in the world now is maybe a shift from that, which again could be the reason why there's kind of a conflict here for him, to see that shift from how he wants to be, how he would like others to be, and how they actually are. And maybe being frustrated by that potentially, or difficulty coming to terms with the reality of how life is for him now.
Did you have these feelings of loss more acutely in the hours before you collapsed?
Okay, so great. So again, she's so kind of on the money with this straight away. Loss, because that's what he's talking about, really. There's a loss here, and loss can be in many different ways. Loss doesn't necessarily have to be the loss of a person in our lives, but it can be loss of something that we've had, a period in our lives, a particular career or thing that we were doing, and we lose that. We kind of have to go through a grieving period in order to move forwards from that. So that, she's picking up on that there's loss here for him.
I don't know.
And again, he's straight away, he's dismissive of that. He's kind of, he's kind of dipping his toe in to the session with her. He's kind of a little bit in there, so he's giving some information. But it's almost like as soon as she asks him to think a little bit more critically about the particular situation, he's kind of dismissive of it. Maybe it's stress. Well, I don't really know why this is potentially a problem. He's not really engaging in that part of the discussion. So he's sort of dipped his toe into the session, but he's not kind of fully immersed into kind of exploring this.
I'm telling you, it'll all blow over.
Didn't you admit to Dr. Cusimano that you were feeling depressed?
Okay, so you can see, I think, on several parts of this session, how dismissive Tony is of his issues. Again, it's just stress. I don't really know. I'm fine. And again here as well, it's just going to blow over. So this is somebody that dismisses their problems, that doesn't take their concerns seriously. And again, Dr. Melfi here at this point in time, that she actually doesn't let this go each time. So she's always curious, or she always pushes back. You've got the situation here where they think this about me. Well, no, she'll pull him up on that and say, well, actually, what do you think? And in this situation right now that he's saying, just blow over, it's not an issue. Well, then she brings something back in and says, well, actually, no, you've spoken to somebody else and said that you think you might be suffering with depression. So she's taking him seriously. She's kind of not dismissive of him. And I think that's a really good way of kind of trying to counteract the dismissive nature of him and his issues, that she just brings it straight back in. She's not just going to let that go. She's not just going to say, oh, well, it's fine, it's okay. Well, if you think it's blown over, then it's blown over. She's sort of pulled it back in and gone, well, no, let's wait a minute here. Actually, you've mentioned that you think this is depression, so you think there is something in this. There's something that actually is an issue for you. Okay, and that's completely stopped him in his tracks. And the reason that is because his his dismissal of himself is what we would call a defense. It's a way of blocking off taking him seriously. And that defense didn't work just then, because maybe in everyday conversation what would happen is that you would maybe say, it's no big deal, I'm fine. And maybe somebody else would go, oh, okay, cool. I'm glad to hear that sort of everything is okay. But in this therapy session, she hasn't done that with him. She's not dismissed him. And that's kind of stopped him in his tracks now. So it would be interesting to see kind of what he's going to come back with in response to this. Because I imagine he can't keep doing the dismissal thing, because she's going to keep pulling up on him. So it'll be interesting to see sort of how he responds to this, because obviously you can see the cogs are going right now in his mind. He's trying to think of how do I respond to this? What's my response going to be in this?
Melfi. What part of the boot you from, hun?
Dr. Melfi.
Okay, so that's kind of great in that response just then. So she's pulled him up. She sort of said, "Hey, somebody else has said that you're suffering with depression here. That you've said that to them." He's used his dismissal sort of way of dealing with it, and that's not working anymore. And there's a complete change of tack by him in this moment in time. He's dismissing her now as a professional. He said, "Oh, Melfi, where? I can't remember the exact words, but where are you from, hun?" He's absolutely trying to dismiss her as a professional right now. He's almost like trying to take some power in this situation. You could imagine, and maybe if you've sort of seen the show, that there's a dynamic in here in how he treats women, and maybe trying to almost flirt with her to some extent at this moment in time. That's maybe a way of trying to disarm her. And again, she's so great in her responses to that, because her response to that was, I'm doctor, I'm not getting pulled into this dynamic. You're not going to position me in that way. That's not who I am. So again, this is kind of a different tack from him. He's almost trying to block what she's trying to do right now by trying to dismiss her. And again, she's fought back. She's just having none of it.
My father's people were from Caserta.
Avellino. My mother would have loved it if you and I got together.
Okay, so he ramps it up even more. This is kind of a way of trying to flirt. This is kind of a defense of making this not a therapy session anymore. Well, this is just two people having a chat. We're having a flirt. This isn't very serious. So again, it's dismissive of himself in a way, but it's trying to disarm the therapist too. And he's almost trying to take out the pressure of the session, I think, really, in this way. He's removing the focus off him onto her, which again is another kind of tactic that can be used. These are all kind of subconscious things. He maybe isn't fully conscious of sort of of what he's doing in this moment in time, but actually he's trying to move it towards kind of this flirty, sort of chatty conversation, which is removing it from the therapy that it is.
Anxiety attack.
Okay, and again, she's just not going for it. She's not even actually entertaining that conversation with him. She just goes quiet and she moves on to talking about anxiety. And if you just look back there, you can see with his facial expression is almost like, this hasn't worked. I've not got the response here that I was hoping to get. These sort of these tactics, these strategies I'm trying to use to block off focusing on me and my issues is not working.
Anxiety attacks are legitimate psychiatric emergencies. Suppose you were driving and you passed out.
Let me tell you something. Nowadays, everybody's got to go to shrinks and counselors and go on Sally Jesse Raphael and talk about their problems. Whatever happened to Gary Cooper, the strong, silent type? That was an American.
Okay, so this kind of fits back into the conflict that he was facing and talking about earlier on, because he was talking about his father. His father had kind of standards, ways of being, and in a sense, he's almost reaffirming that idea here right now. You know, he's getting angry. I think he's getting angry at her right now, which tends to be what happens when your defenses are blocked. There's a rise in anger towards the therapist, and the reason that is because your defenses, in a way, are trying to keep you protected from something that's uncomfortable, and she keeps blocking those defenses, so he's becoming more and more uncomfortable. Well, if somebody's making you feel more and more uncomfortable or removing the things that you think are keeping you safe, you're probably going to start to get annoyed. So I think right now there's some anger that's coming up for him towards her, but also anger, I think, at the fact and frustration with himself that he has an issue that he's having to deal with, that he's anxious, that he may be depressed, that he's got this kind of conflict, he's got panic attacks. So for him too, he's struggling with something right now. And on top of that is what sounds like kind of the view of how he wants to be. That he wants to be this kind of strong, silent type, you know, kind of archetypal, masculine, I guess kind of toxic, masculine role that he wants to be, that he would have seen in his father, in his father's generation. And right now he's struggling with something that's going against that, which is probably also going to be tied up in shame, because on some level he's doing something that internally, due to this kind of dynamic that he's seen in his father, he's doing something that he probably feels he shouldn't be doing, and that's kind of being highlighted in this session right now. So there's a lot going on for him in this. You know, this isn't just about going there sort of talking about his problems, but actually there's a whole conflict that he's facing even before he begins to talk about his anxiety, and you know, and that's being highlighted right now because of actually, I think Dr. Melfi's sort of continued questioning, pushing away his defences, and all of that allows for this kind of conflict to come to the surface. And this wouldn't have happened without these sort of questions that she'd been asking him.
He wasn't in touch with his feelings. He just did what he had to do. See, what they didn't know was once they got Gary Cooper in touch with his feelings, that they wouldn't be able to shut him up. And then it's dysfunction this, and dysfunction that, and dysfunction motherfucking.
You have strong feelings about this.
Let me tell you something.
Okay, now that's a great intervention here from Dr. Melfi again. So there's this real, you can see the anger coming from him, and the anger seems to be around this idea of what it's like to get in touch with, touch with your feelings, and how it ruined this person he's talking about, this kind of strong macho man, who suddenly got in touch with their feelings and then they changed as a person. So you could also imagine as well that maybe he's sort of anxious and nervous about what's going to happen if he gets in touch with his feelings too. Maybe that he's worried that that's actually going to change him. And I think this can be quite a kind of a common misunderstanding about what it means to be in touch with your emotions, in a sense that somehow that you're going to shift as a person. If I get in touch with my feelings, then I'm going to be in touch with my feelings forever, all of the time. They're constantly sort of going to be there, which is just, you know, it's just not is the case, in a sense. There may be some emotions here that he's sort of struggling with based on what's happening in his life, and to work through them would probably be, you know, very beneficial for him. But there's a whole lot of working this, and her response there was to sort of voice it. Well, you've got feelings around this, haven't you? But she also looks a little bit nervous as well, which is unsurprising, you know, given kind of the energy that's coming off sort of Tony at this point in time. But she's staying with it. She's pushing on for the feelings too.
Something. I had a semester and a half of college, so I understand Freud. I understand therapy as a concept. But in my world, it does not go down.
So again, that's kind of a classic thing that you maybe sort of hear, understand, is that somebody's read a book on it or somebody knows a little bit about therapy. So I understand it, really. I know what this is all about. But again, he's kind of voicing this other conflict that he's got, that. Kind of him being there is going against the world that he lives in. that he really shouldn't be there. So he's facing a real dilemma right now being there. The reality is he wouldn't have gone there if he, on some level, didn't want to be there. People don't turn up in therapy offices unless on some level they really want to be there. So there's part of him that does want to be there. And there's also a part of him that sort of is denying his right to be there, really, because he has every right to be there and to work on these things. But it goes against the world that he lives in. So that's the struggle he's sort of facing right now, being there in the office.
Could I be happier? Yeah. Yeah. Who couldn't?
Do you feel depressed? Do you feel depressed?
Since the ducks left. I guess.
Okay, so that's I would consider that quite a big breakthrough right there in this session. You've gone from a man here walking in who was absolutely resistant, very cynical about being there. He was not going to name that he had an issue at all, but there's kind of, because of the questions and the work that Dr. Melfi has been doing with him in this session, you get to a point where he's able to acknowledge the fact that actually, yes, I do feel depressed. Which, is actually quite a significant breakthrough in a first session with somebody who's clearly highly resistant to the idea of being in therapy.
The ducks that preceded your losing consciousness. Let's talk about them.
Okay, so that was one step too far by the looks of it. That was definitely one step too far in this session. She kind of had a breakthrough. He'd acknowledged he has a problem, but he's got a whole part of him that's so resistant to being there in therapy. So you imagine every time he moves forwards, there's almost like a backlash against that. The part of him that says, I want to be here. The part of him that says, I would like to talk about these things. Every time that part of him makes a step forwards, this other side of him that says, well, men don't open up about problems, that you shouldn't have anxiety, you shouldn't be depressed, you shouldn't go and see somebody. That bit kind of backlashes against it. And the thing is, when that part isn't dealt with in therapy, the further you go, the harder it pulls back. And right now there was kind of, he's had his dismissive defense blocked. He'd had the bit where he was trying to say everyone else was saying this is a problem and not me. She'd done all of that work with him to get him to recognize, to acknowledge and say that he was depressed. And it felt that kind of that pushing a bit further at that point in time was too much. And he's gone. He'd gone further than really he probably was able to at that moment in time. And he's left the office at that point in time.